The respiratory and circulatory system. First, we will look at the path of gases as it travels from the external environment to the lungs. Breathing occurs when the diaphragm, a sheet of muscle below the lungs, contracts and relaxes. When the muscle contracts, the volume of the thorax increases and in turn the pressure decreases. The external air pressure is now higher than the internal pressure, causing gases to move into the body as they move from a region of high pressure to low pressure. This is called negative pressure breathing. Oxygen enters through the nostrils or the mouth, while carbon dioxide leaves the body. The nose filters the air with its hairs and also warms and humidifies the air. The air goes through the pharynx, the larynx, the trachea, the bronchi, the bronchioles, and finally the alveoli, which are the air sacs at the end of the bronchioles. We will be taking a closer look at the structure of alveoli and how it relates to its function. Alveoli are tiny air sacs, and the lung contains millions of them. Being small but numerous greatly increases the overall surface area where gases can diffuse. In fact, the total surface area of the alveoli is around 100 meters squared. A dense web of capillaries surround each alveolus, shown by the red and blue lines. Red represents a capillary with oxygen-rich blood, and blue represents oxygen-deficient blood. Alveoli have a thin layer of epithelial cells on its inner surface. The web of capillaries and the thin layer of epithelial cells all allow for gases to enter or exit the bloodstream through simple diffusion. Once oxygen reaches the alveoli, it dissolves in a film of moisture on the epithelial cells and diffuses across into the blood capillaries, while carbon dioxide goes from the capillary into the alveolus. Molecules of each kind of gas will diffuse down a gradient of their own partial pressure independently of other gases. Partial pressure is the pressure a certain gas molecule exerts. Like the diffusion of non-gases, oxygen will move out of the oxygen-rich blood following region of higher partial pressure to lower partial pressure. We will now be focusing on the structure and function of the capillaries that surround the alveoli, and are found in many of the parts of the body. Capillaries are the only type of the three blood vessels that allow diffusion. This is because they are made up of a very thin wall of a single layer of epithelial cells, and wrapped in a thin basal lamina. The interior space is just large enough for a single file of red blood cells to pass through. Finally, the interior has a smooth surface that prevents red blood cells from being abraded. Oxygen and carbon dioxide diffuse through epithelial cells of capillary wall into the neighboring tissue. Larger molecules transport through endo and exocytosis. The two other kinds of blood vessels, the arteries and veins, have much thicker and sturdier walls. Arteries and veins have a middle layer of smooth muscle that can constrict and relax to regulate blood flow. Both have an outer layer of connective tissue with elastic fibers that allow them to stretch and recoil. All of these structural aspects exist, so arteries and veins have the strength and elasticity to accommodate rapid flow and high blood pressure of blood coming from the heart. Finally, we will look at the components of blood. Blood is made up of plasma and cell parts, such as the red blood cell. The red blood cell are small biconcave discs. This creates a larger surface area for oxygen to diffuse across. Furthermore, red blood cells dissolve their nucleus to create more space for hemoglobin, the protein oxygen attaches to. As for the plasma, which is 90% water, and the other component of blood, it contains ions, nutrients, waste, plasma proteins, oxygen, and carbon dioxide.
Cystic fibrosis. Cystic fibrosis, or CF, occurs in the respiratory system. It is a progressive genetic disease that affects mucus and sweat glands and makes it hard to breathe. It can cause lung infections, lung damage, and sometimes respiratory failure. Symptoms include cough, which can be chronic, pulmonary hypertension, shortness of breath, fatigue, chest cold, infections, pneumonia, salty sweat, or weight loss. Since CF is a genetic disease, one must inherit two defective CF genes, one from each parent. The defective genes contain a mutation that affects the cystic fibrosis transmembrane conductance regulator, or CFTR gene, which codes for a protein also known as CFTR. The CFTR protein resides in the surface of epithelial cells, which line the lungs and sweat glands. In normal cells, the CFTR protein acts as an ion channel that transports chloride in and out of cells and regulates the passage of salts. In normal cells, the CFTR protein acts as an ion channel that transports chloride in and out of cells and regulates the passage of salts. The most common mutation, delta F508, is a deletion of 3 nucleotides, which leads to the inability of the protein to release chloride. In people with CF, salt travels to the skin surface with the water when they sweat, but the salt is not reabsorbed. These low salt levels in the body can lead to fatigue, weakness, fever, muscle cramps, stomach pain, vomiting, dehydration, and heat stroke. In the lungs, airways are covered with a thin, moist film called airway surface liquid, or ASL, a salt-containing liquid, and a mucus gel layer. ASL traps bacteria and foreign particles, while cilia on the surface of the airway cells constantly move the particles out of lungs, which protect the lungs from infection. They do this by moving back and forth in a continuous sweeping motion and pushing mucus that contains foreign particles and trapped bacteria out of the lungs. Because the CFTR proteins do not function normally, decreased chloride transport and excess sodium transport out of the ASL occurs. This causes it to lose volume and the mucus gel layer to become dehydrated. The mucus is no longer a lubricant, and the buildup clogs airways and traps bacteria, which can lead to infection. Thickened mucus also prevents the diffusion of oxygen and carbon dioxide through the epithelial cell membranes, which makes it hard to breathe. Unfortunately, while it cannot be cured, the symptoms can be treated. People who have CF need to stay hydrated and maintain healthy salt levels in the body. Sports drinks that contain electrolytes can help to replace lost salts. Preventative measures, such as pneumococcal vaccines, can prevent pneumonia, while antibiotics stop the growth of and kill bacteria to prevent infections. Cough medicine may thin or loosen mucus, and postural drainage and chest wall oscillation drain mucus from the lungs. Postural drainage is when one gets into a position that makes it easier for mucus to drain from the lungs, such as lying on your back or your side. Chest wall oscillation is using a device that presses on the chest to remove mucus from the lungs.